Today I have a special guest who bravely shares her story about how the management of her Prolia treatment went very wrong and changed her life forever at a young age. Before you meet Lora, I want to share a little bit about her background with you. Lora was a healthy child. She hit puberty at a normal age of 12. In her teen years, they were filled with many physical activities, and like many of us in the 70s and 80s, a little bit of yo-yo dieting. But despite her dieting, she always maintained a healthy menstrual cycle. Like many who leave home at university, Lora's indulgence in fast food led to the freshman 15. But before long, she realized that she had to learn to eat healthy and has done so ever since. She's always loved to exercise. As an adult, her exercise choices were mostly cardio, bike, elliptical, and running. But she even managed to train for a half marathon. Lora had never broken a bone, but when she hit menopause at age 50, she thought, well, it'd be wise to ask her gynecologist for a bone density test. Welcome, Lora. Could you tell listeners the outcome of your first bone density test?
I was diagnosed with osteoporosis and osteopenia.
And so was there any recommendations for you after that test?
Absolutely. The doctor recommended that I start on a bone drug.
And how did you respond to that?
Well, I did take an oral medication once. It did not make me feel good. And also in the back of my mind, I did not want to be on a bone drug. I wanted to work on building my bones naturally. And so I opted out of taking that at that time.
What was the approach that you took?
Well, I looked at my diet, making sure I had the right nutrients, including calcium, etc. And I hired a trainer to help me lift weights and made sure I was doing those two things, which is what I thought were the two important drivers of bone health.
Yeah, and they are. Sometimes in our first menopausal years, we're losing bone so quickly that it's hard to build during that time. It's sometimes easier to maintain. But so then after those 2 years, my understanding is you had another bone density test. Is that correct?
That is correct. And at that time, I was told that it had gotten worse and was advised to go on Prolia.
Did you heed that advice?
I did. The doctor did stress that if I didn't, I would be probably looking at fractures in my 80s and described what that would be like on as far as recovery and pain, etc. So yes, I did start it at that time.
Okay, and how did your body do with the Prolia injections?
It was fine. I didn't have any sort of negative reactions. I got them every 6 months, so you get it, you kind of forget about it. But in the back of my mind, I still had the thought that I really don't want to be taking a bone drug.
So you had I believe 3, 4, or 5 injections. How many injections did you have?
I had three, so over a
3.
year, yes.
Okay. And then what happened after those 3 injections?
It was the time I was supposed to be going back, so that would have been, I think, a year and a half, 2 years. After I started, I was seeing a new functional medicine doctor. And so I talked to her about stopping the Prolia shots again because I wanted to do it naturally. And she supported that decision and said, the drug doesn't work anyway. So yes, stop it.
Did she have any strategies or other recommendations to transition off the drug?
She didn't offer anything. I had mentioned that I'd started going to Osteo Strong, based on what I'd read about it, the being able to build bone through this program. So I told her about that and she supported that. And that was the length of that conversation.
Okay, so then what happened?
Well, about 6 months later, what I know now is I fractured.
So you knew that you had fractured because of the pain that you were experiencing, or was there other imaging?
So I did not know that I fractured at the time. Um, I knew something was wrong. I was having some back pain, but it didn't present itself the way I thought it would if it was my spine. It was in various places in the back. And so I went to the doctor and she recommended I see a physical therapist. I mean, at that time, I did not know it was a fracture. Again, looking back, I do know that that's what had happened.
Okay, so you go to physical therapy, and then what happens?
Well, he basically told me it was muscle. He did have me do some certain movements. He was aware that I had osteoporosis, um, but even the tests he did, that's not what he was looking for. And
Hmm.
so I don't know if it was because of my age or just his lack of knowledge. I'm not sure, but he decided it was muscle. And so he gave me exercises and stretches to help muscle pain, which was all the wrong advice when you have fractures, or even if you just have osteoporosis.
And from our conversations, my understanding is you usually left there feeling worse than better.
Correct.
Okay, so at some point, since you were not getting relief from the physical therapy, what was your approach? What did you do next?
Well, he had advised me to ask my doctor for some muscle relaxers. So I reached out to her and asked her for muscle relaxers and told her that the pain's getting consistently worse. And at that time, she basically said no. Um, she advised that I go to the emergency room or find a doctor that was local to me since she was about an hour away. I didn't look at that point because I thought this is not an emergency.
Hmm.
And um, I grew up in an era of suck it up, buttercup. Uh, and I thought I can deal with the pain. I was believing what the physical therapist was telling me still. And so I did not react on that advice immediately. But about 2 weeks later, it was so significant. I was crying every single day. I went back to the doctor and said, I don't need muscle relaxers. I need an x-ray or an MRI. Something's going on. And at that time, she gave me the same advice. I don't think it was advice.
Yeah.
She basically said she was not going to send me for an x-ray or an MRI to either go to the emergency room or find another doctor, which
Oh,
I did at that time. And I did go get an x-ray.
okay. So, Lord, just a little idea of from the time you started physical therapy until you finally got an x-ray, what was that period of time? Because you were suffering a lot during that time period.
Yes, it was 3.5, 4 months.
Wow. And can you describe, how well you were functioning during that time? Because everybody deals with pain differently, and I know you're really stoic. But how was that impacting the things you love to do, the activities you could do, your work?
Right. So I couldn't do anything. I literally sat in a chair and the physical therapist even advised me not to lay down. So I was standing up and sitting all day long, just in pain. I was lucky because I do work from home. So I was doing my job as usual, but in constant pain. It was very,
Mm.
very hard to think about anything outside of the pain and just thinking it was going to get better, it was going to get better when it just consistently got worse and worse.
And in terms of, you know, after work activities, were you able to do any of those things? Like, what was your overall, quality of life, I guess?
The quality of life was bad because I was literally doing the basic things to keep going from one day to the next. Um, yeah, it was horrible. I did not want to get out of bed. I would get up and just be miserable immediately.
Mm.
Um, I did have to do Zoom meetings with clients, et cetera. And that was very difficult to put on, a happy face, having in the back of my mind how much pain I was in and trying to stay distracted enough to accomplish what I needed to accomplish to get paid. But other than that, I did not have any sort of real living. It was just existing to get by and to hopefully get better.
Okay, so you finally go to emergency or to a new doctor?
I went to a new doctor.
And what happened then?
He did send me to get an x-ray and scolded me rather harshly for going to a physical therapist without an x-ray. So I did get the x-ray and found out that I had fractures.
Okay, and so what was the suggestion or treatment approach?
Well, he was very dismissive, told me he'd send me to pain management and that would probably be the rest of my life. So I went back to doctor number one and asked her, is this enough for you to send me for an MRI? And she said, yes. Sent me to an MRI, got that back. And then she sent me to an orthopedist who saw me and said, only people with severe osteoporosis have this many fractures. He was surprised I could even walk in the room.
Wow. And did he have any advice for you?
Well, he told me, don't bend forward, don't bend sideways. Told me I can lay down to relieve the pressure on my spine, um, not to pick up anything over 5 pounds, and get on another bone drug ASAP. That I absolutely did not have any choice. He said my spine was barely visible in the x-ray, and he wanted me to be as careful as possible to not fracture any more than I already had, which I don't know if I already mentioned, there were 10 fractures at that time.
Did you end up going on another medication?
I did. I started Avinity and completed that for a year, which is what my endocrinologist recommended. After that year, then had me start Forteo, which is what I'm on currently.
Okay, so along the way you got an endocrinologist.
Yes.
Good. And your first functional medicine doctor that had mentioned that you could stop the denosumab or the Prolia, um, is she still in your life?
She was fired.
Congratulations. Okay. Um, so Laura, how are your days now? Like, what is your pain like? What is, your outlook for life like? Because you're young, you're not even 60 years old.
I I am feeling so much better. I'm 2 years in, and really I think I've started feeling the effects of the Forteo and my bones getting better, probably just even in the last couple of months. Um, but my life is going to be completely different than I had ever thought about or projected. The way I exercise is completely different, much more limited. I'm still limited on how much I can pick up. and carry. I lost 3 inches and possibly more. I haven't measured myself in a while, but that changed my body so drastically. I've literally had to give away all my clothes. It's difficult to dress, and I know that might sound superficial, but it is part of your identity, or at least it was for me. So that's been a struggle. I haven't been able to travel. I haven't been able to go to work conferences. Um, it's just, it's so disappointing to know that this didn't have to happen. And I had so many people let me down. Um, yeah, but I, I do have a bright future. There are people every day that go through this and worse, I'm sure. And we move forward with what life presents us and makes I have to make the best out of it because I've only got one chance. But again, it's hard not to be drawn back into the disappointment. Um, but I'm working on it.
Okay. So two things that didn't totally come up in our talk, but it has come up in the past, is how many interactions you had with healthcare professionals along the way, be it your gynecologist, be it your functional medicine doctor, be it the physical therapist that had the history of the drug that you were on and never once correlated your pain to the potential of having the rebound effect caused by discontinuing the denosumab. And at any point along this whole journey, did anybody put the two together for you?
I had many interactions with doctors that should have seen the red flags. And I was going to say funny enough, and it's not funny at all. I had asked my gynecologist literally a month before the first fractures if I could have another DEXA scan because it had been 2 years and I just wanted to know the progress. And he told me no, that basically you have osteoporosis, deal with it. And I quite possibly would never have fractured if they had started me on the drugs that needed to bridge that gap after Prolia. So that's disappointing. And then my functional medicine doctor, I met with her multiple times, asked her, told her about the pain, had the new doctor that just wanted to put me on pain meds for the rest of my life, had the physical therapist that I saw over 3.5 to 4 months every 2 weeks. And none of them, not one, questioned osteoporosis and the drug I was on.
Okay. Very disappointing, which is part of the reason we're having this conversation today, because it's something I was first exposed to with a client in 2017, and I was really saddened and shocked to hear your story. And so if you're going to share a message for other individuals that are considering starting denosumab or are currently on denosumab, what would your messages, or what are your messages?
So the first thing is you have to know your bone health. As I said about the gynecologist not giving me the DEXA scan, I should have just gotten the DEXA scan myself, and I wish I would have because that's probably $100 out of pocket. So I could have done that, and I think it's just imperative for people to know their bone health. It is not something that you can feel necessarily until the fractures. And you definitely can't tell from the outside. Like I was working out, I was physically looked fit. So there's no way of knowing without having something like a DEXA scan. The other thing is I want them to know to really listen to your body. When I initially fractured, I did feel my body was in shock, but I did not know what to make of that.
Mm.
So I really wish I was more in tune with what that meant and pushed harder with my doctors. Um, Also, if you're in significant pain, which I did get to that point. You just cannot think clearly. Like I said, I was just doing what I could to get through the day. Really recruit family and friends to help you navigate that. I mean, we have to be our best advocate. And if you're not able to do it, you've got someone that loves you that will. So that would be the second. And the third thing is now, obviously, get second, third, fourth opinions. It is really important that you understand that not every MD knows everything. My doctor, I don't think she maliciously had me stop without a transition drug. She did not know, but I should have gone myself and get other opinions. Because again, we have to be our best advocate. I had faith in her to know the right thing for me. I had faith in the gynecologist to do the right thing when I asked for the DEXA scan. I had faith in the physical therapist, knowing that I had osteoporosis. And even through all my suffering and communication with them of what I was feeling, like none of them came through. And instead of just letting that play out for the length of amount of time I should have immediately found another doctor, another physical therapist, etc. So I will always get more than one opinion now.
Very wise advice. So Laura, thank you so much for sharing your story. And I know it's been difficult, and we've, but I think very, very helpful and beneficial for many individuals out there.
I hope so. I hope nobody has to go through this.
A diagnosis of osteoporosis can take you down numerous paths. If you have a heart problem, you see a cardiologist. If you have a stroke, you see a neurologist. Unfortunately, no one medical specialty owns osteoporosis. As a result, denosumab is often prescribed by GPs or specialists who have a part-time interest in osteoporosis and sometimes incomplete knowledge about the risk of the mismanagement of denosumab. Lora interfaced with over a half dozen healthcare professionals. Not one of them were concerned about the risk of her discontinuation of denosumab, nor did they think that her back pain was possibly due to spontaneous vertebral compression fractures. Starting or stopping denosumab should not be taken lightly. It is a very effective drug, but stopping it without a transitional plan places you at a serious risk for rebound fractures. By sharing Lora's story, we hope to save others from a similar fate. If you know anyone who is currently on denosumab or considering this drug, please share this story with them. Thank you for joining me.